Improve CT workflow efficiency by eliminating the term iodine allergy. We sought to determine if workflow efficiency improves by eliminating the informal term iodine allergy when obtaining patient history for contrast-enhanced CT. Remember that iodine is an essential element that we all need to live, so important that it's put into our salt supply. It's a component of thyroid hormone that regulates cellular metabolism. Unfortunately, the word iodine is also informally used to refer to at least 3 unrelated possible allergens, including iodinated contrast, but also iodine-based topical soap. And some people still use the word to refer to shellfish allergy. That's actually an allergy to a muscle protein. So the informal use of the word to mean at least 3 unrelated allergens leads to a lot of misunderstanding and misperception. Iodinated contrast is not a single substance, of course, but a drug class, including the older ionic hyperosmolar agents, which tended to be a little more allergenic and more symptomatic on injection, and then the newer non-ionic lower osmolar agents, which are better tolerated. As an example, if someone were allergic to penicillin as their actual allergy, it would never occur to us to say, well, they're allergic to antibiotics. And why don't we just say they're allergic to carbon informally, because carbon's a component of penicillin, even though that's not really what they're allergic to. And yet that's precisely what we've unfortunately allowed to happen with the informal terminology regarding IV contrast. Here's an example of an older ionic agent. People who are allergic to this almost never know the actual contrast agent by name that they're allergic to. So at best, they may say they're allergic to iodine-based contrast, but then they may use the term iodine informally, which of course can mean other things and lead to a lot of confusion. The method of our study was at a large multi-center outpatient private practice that performs over 35,000 CT studies annually. We changed the patient assessment questionnaire. It used to read, are you allergic to iodine or X-ray dye? It now reads, are you allergic to iodine-based intravenous contrast, previously sometimes called X-ray dye or iodine? Then we polled CT technologists who worked at the offices both before and after the questionnaire was changed. And the techs were asked based on the speed, the efficiency of prepping patients in the review process, the need to call the radiologist for possible allergy concerns. The technologists were asked, did the change in the questionnaire wording lead to no improvement, some improvement, or significant improvement? Of 23 technologists polled, all said that there was an improvement with the improved wording. And in fact, all but one said that it was a significant improvement by changing the terminology. One said there was mild improvement, and this led to a strong statistical result. By simply using accurate terminology, are you allergic to iodine-based intravenous contrast, instead of the informal and confusing, are you allergic to iodine, the CT technologists found a statistically significantly improved patient review process prior to performing their contrast CT. The comments were that there was improved communication, less ambiguity, a quicker discussion with the patients, and fewer misperceptions that unrelated allergens like iodine, soap, or shellfish might be contraindications to IV contrast. The technologists did caution, however, that some patients still arrive thinking that unrelated allergens like iodine, soap, or shellfish might still preclude their getting an injection or at least be problematic. And some of these patients have this information from their referring physicians, so more work needs to be done. Our recommendations are to call allergies by their actual name, avoid confusing informal or slang terms like iodine and iodine allergy, and for further education of patients and ordering physicians.